How can misdiagnosis affect euthanasia decisions? Imagine making a life-changing choice based on incorrect information. That's what can happen when a medical diagnosis is wrong, especially in euthanasia cases. When doctors misdiagnose a condition, it can lead to premature or unnecessary euthanasia. For example, if someone is wrongly diagnosed with a terminal illness or severe mental health disorder, they might request to end their life thinking they have no hope. But if the diagnosis is false, they could have lived many more years with proper treatment or support. In euthanasia debates, one big concern is respecting a patient's right to make decisions about their own life. But that right depends on having accurate information. If a patient is told they are suffering from an incurable disease when they are not, their choice might be based on false premises. This can violate the ethical principle of informed consent, which says patients should fully understand their condition before making such a serious decision. Misdiagnosis can also distort the assessment of suffering. If a doctor wrongly attributes a patient's distress to an untreatable condition, euthanasia might seem justified when it actually isn't. For instance, depression or treatable mental health issues can sometimes be mistaken for more severe psychiatric disorders. If these are not properly diagnosed and treated, the patient might opt for euthanasia when they could recover or improve with therapy. Physicians have a moral duty to avoid harm and protect vulnerable people. This means they need to be very careful and thorough when diagnosing. Multiple evaluations and second opinions are often necessary to confirm a diagnosis. It's especially important to correctly distinguish between conditions like dementia, intellectual disabilities, and psychiatric illnesses, as confusing these can lead to wrong euthanasia requests. Legal safeguards are also vital. Doctors must ensure patients are competent to decide and are not suffering from treatable conditions like depression that impair judgment. When patients lack capacity, advance directives should be carefully reviewed to avoid acting on mistaken assumptions. In the end, a misdiagnosis can lead to irreversible decisions that end a life prematurely. It challenges the core ethical principles of respecting autonomy, doing good, and avoiding harm. That's why accurate diagnosis, clear communication, and careful evaluation are essential in euthanasia discussions. Protecting vulnerable individuals and ensuring decisions are based on truth is key to ethical practice in this sensitive area.